doctors who have always stood on the front line, tending to the sick by putting others' health above their own.
Dedicated healers, tireless caregivers, compassionate and selfless unsung heroes of our healthcare system. Their well-being is the foremost important thing.
Violence against them is not new.
But in recent times, it has grown in epidemic proportions.
In the ever-growing medical needs, healthcare professionals stand at the forefront, protecting patients and safeguarding them. But what do they get in return?
It is not in the recent times. In the recent times, the AIMS doctor saving a toddler on the flight in the recent times has winning hearts all over the world. And an young doctor performing CPR on the patient at the patient collapsing due to a cardiac arrest is also an interesting thing. Well, the patient is being electric shock. The CPR helmet various ways. But what do they get in return?
A warning thought to discipline in the workplace because of the violence they are facing. There are many unsettling events against doctors in recent times, which include an intern doctor got beaten up by the patient in the casualty ward at Tirupati on 24th August. And the police turned violent after being asked to wait for a CT scan or an MRI, which is very cruel and brutal.
There are many doctors who are attacked or died during COVID while treating patients. Not only in recent times, but also in the past, there are many incidents where doctors faced violence. 75% of doctors face violence on a daily basis, where most cases go unreported.
According to the World Health Organization,
The workplace violence is defined as a situation where the staff have been arrested, attacked, or mistreated in an event that is related to the work, including traveling to or from the workplace, involving implicit and explicit challenge to the safety, well-being, and health. And it says that the healthcare workers are 4 times more prone to the serious workplace violences.
types of violence on the healthcare workers, they lead to the following effects like threat, fear, stressed, depressed, and not wanting their children to enter this noble profession, and they are doing protects for being unsafe. Who is responsible for their safety and security at workplace?
According to the Indian Medical Association statistics, 82.6% of doctors in India are feeling stressed in their professions.
46.3% say violence is a main cause of stress for many doctors.
And 62.8% of the doctors who are surveyed are not able to see their patients because of fear of violence.
24.2% fear of being prosecuted.
And 57.7% of doctors are thinking to hire security at the workplace.
56% of doctors do not get a comfortable 7-hour sleep most days of the week.
It is not the bruise on the body that hurts. It's the wound of the heart and the scars in the mind.
AIM, assessing the impact of workplace violence on psychological well-being of medical professionals and suggest suitable preventions to prevent them.
Objectives: assessing the type of workplace violence experienced by the medical professionals and how frequently are they experiencing it.
Assessing the impact of workplace violence on mental and psychological health of medical professionals.
To identify and suggest the solutions to reduce the violence and support the affected medical professionals.
Methodology. The type of study is cross-sectional study, and area of study is tertiary hospitals, nursing homes and clinics in the area of Vijayawada, Guntur and Mangalgiri. And the study population is surgeons, physicians and postgraduates and residents.
Sample size is 100.
Selection criteria.
The inclusion criteria. It includes actively practicing medical workers such as the doctors, physicians, and nurses, and etc. The practices who are willing to give their informed consent are also included.
Exclusion criteria. The medical participants who are not practicing in the medical sector and participants who are not willing to give the informed consent are excluded from the study.
We utilized the questionnaire developed and published by Syria General and conducted one-on-one interviews, keeping their identities confidential.
Our questionnaire consists of 37 questions divided into 5 sections. Section 1. Forms of violence. 2. Impact of the incident. 3. Comfort in reporting the incident. And 4. Mitigation strategies. 5. Risk factors associated with the workers.
Results.
Among Section B, 100 positive responses, 57 are females, 43 are males.
Highest incidence of workplace violence is seen in the ages of 20 to 30, and the highest incidence of workplace violence is seen in the departments like critical care and emergency medicine. Section A. Section A speaks about physical and verbal violence. Verbal violence is positive for 37 responses, and both verbal and physical violence is positive for 63 responses. And these two graphs show about the statistics we obtained from our research. And the highlighting and shocking fact is more than 50% of our subjects faced verbal violence once in their lifetime.
Section B, the immediate efforts. 5% of the doctors does not care at all. And 34% of the doctors are getting demotivated and less efficacious. And 18% of the doctors are thinking to get out from the workplace. And 3% of the doctors are thinking to change their career. And 28% of the doctors are not willing to work at all. And 12% of doctors are thinking to do self-harm. And in the pie chart, 36% of doctors are losing their self-care and well-being, which includes lack of sleep and good eating habits and lack of proper exercise and lack of good clothing and grooming.
Yeah, 80%, 20% of the doctors who feel it impacting on their family life, affecting, making them feel distant from the close ones. There are 18% of them who feel it impacting on their social life and social media. And 26% found the behavior changes, which includes aggressiveness, being irritable, and etc.
Section C. Comfort in reporting the incident. About 17% are neutral, 34% agreed, and whopping 49% agreed on reporting the incident.
Reasons of discomfort. 9% felt ashamed of reporting such incidents. 21% believe that no action will be taken against the perpetrator. 12% think lack of organizational support, whereas 26% believe that there are no provision to report such incidents, and 14% think that the process was time consuming, whereas 18% believe
Section E. Inappropriate knowledge regarding health conditions and diseases. 6%.
Poor communication skills, 11.32%.
Lack of resources. 7%.
Overcrowding, 5%.
Long waiting time. 5%.
Inadequate security, 8.24%.
No response after the complaint. 6%.
Lack of respect for authorities, 10.2%.
Inappropriate and negative portrayal of media. 7%.
Lack of provision of harsh punishments, 22.67%.
Section D. The Section D involves the implementation of the mitigation strategies. It is the regular training of the medical healthcare workers regarding the soft skills, which enhance and prioritize the proper and healthy communication with the patients, which eventually will have a better prognosis, diagnosis, and treatment of the patient. It also involves good doctor and patient ratio. It also requires developing infrastructures, healthcare facilities, and developing infrastructure within the hospitals. It also requires educating the patients and attenders with regarding of the case scenario.
Breaking news. The need of hour is turning out to be the 13th hour of the clock. The Central Protection of Doctors, which aims to protect the doctors from workplace violence and punish the victims who workplace violence on the doctors.
conclusion. Days that start before the start of the dawn. Mornings that begin with the ring of an alarm. A second taken out to celebrate an anniversary. As 2 hours become 10 in the surgery. Almost home. Almost well. And then the U-turn. Putting their lives on the line. As the whole world searches for a breakthrough. Doing triple duty. Putting their going the classes is too high and too big, with the resources too few. All they need is a bit of respect and self-appreciation for the efforts they put and sacrifices they make by working in this glorifying profession.
Doctors are the warriors of healthcare arena. Their weapons are sutures and scissors. Their confidence is knowledge and treatment. So, Vaidyo Narayano Hari.
So I think that was a good and relevant study. What I would like to ask you is, did you assess how many of them actually reported such events?
Thank you for the question, sir. No, that's not what our study is about. It's about the type of violence they face. So we only chose the positive cases.
So how many of them were reported? Positive cases means which one? How many of them were reported?
Thank you for the question, sir. Out of the 100 we did the survey, about 17 are neutral, about 34 disagreed in reporting, and 49% reported the incident, sir. Thank you.
A very good presentation. Actually, violence against the doctors is a very unfortunate thing, but your way of addressing with angry emotional manner, that is also very good. That's very important. What is your title of study?
Thank you for the question, sir. Our title is a cross-sectional study in assessing the impact of workplace violence on the psychological well-being in healthcare professionals.
Okay, here what is the outcome, what is the associated factor or risk factor?
Yes, sir. Risk factors were present, sir, and the violence which they
The
are facing,
workplace violence is
which they are
the
facing.
strong associated with the
Yes, sir.
psychological well-being outcomes, ill health, mental health. That's all.
Poor communication skills, overcrowding, patient to doctor ratios and soft skills are the most and risk factors for doctors to face violence.
Okay, ma'am.
Sir, I would like to add a point, sir. Due to lack of poor communication is the most prominent reason behind the workplace violence, sir. As many people told us that today doctors are lacking communication skills, sir. This is the most important reason.
Okay, ma'am. Have you selected the sampling?
Sir,
The samples were selected in a random way, sir. So we get the people from all diversities.
Okay. And what type of, so you taken convenient sampling?
We included medical professionals who are actively practicing right now, including physicians, any surgeons or any postgraduates.
Okay.
And also
You followed any criteria? You taken directly as a convenient sampling?
we just took a random sample, sir.
Okay. In sample size, what prevalence you used? In sample size calculation, what prevalence you used?
82.1, sir.
What is that prevalence of what?
IMS, people who feeling stressed out in their profession, sir, due to the violence.
Okay. Stressed out means so many problems are there. Depression, anxiety,
Yes,
like that.
sir.
Which prevalence you taken?
Stressed out, sir. Stressed out is our main concentration, sir.
Okay. What is your recommendation from your study
A better
to
mitigation
the community
strategies
and government?
can be implemented, sir. For example, having a strong implementation of the legislative measures, like having a quick redressal system, better communication, better infrastructure, better medical needs and supplements in the hospital will help in overcome such violence in workplace.
Sir, I would like to add a point that we should be very patient, sir, and we should take some time for the patient. So we should feel that patient is our relative or our well-being, so we can spend time and we can explain everything, sir. Lack of explanation creates the problem, sir.
Okay, ma. That's okay, ma. Good. That's it.
Yeah. My
Thank
only
you.
question or my only point, as he said,
Sir.
is your title is health outcomes, mental health outcomes. Okay. But you have not actually addressed that. The title should have been risk factors and prevalence of workplace violence. So your title is misleading. You are talking about workplace violence leading to mental health outcomes. But mental health outcomes have not been assessed. The assessment of depression, anxiety or any other things have not been done. Okay, so the title is a little misleading is what I feel.
So we are thinking that
Sir, what you said is correct, sir. But in our objectives, we have mentioned that we'll mention about the psychological factors, we'll mention about the mitigation strategies, and we'll...
These are the risk factors you're talking of. It's
Yes,
not mental health outcomes.
Yes,
They're
sir.
two different things. You're talking about risk factors, understandable. Okay, better communication, having all those things are fine. But at the end of the day, mental health outcomes are not discussed because of the workplace violence on the doctors. So the title is something misleading. Otherwise, things are fine.
Yes, sir. Our section B includes the impact of the incident, where the psychological well-being of the doctor is reported. Thank you, sir.
Thank you.
Good job. My God. What about the other one?